Hello, I'm Dr. Spoorthi, General Physician and Endocrinologist at Akkineni Hospitals. I hope you're in good health. Let's explore some key aspects of today's topic. Please stay with us and note them.
Around the world, millions of women and girls are routinely shut out of normal daily life for several days a month. They are barred from entering kitchens or temples, isolated from their families, and treated as if their bodies are physically impure. This kind of isolation creates a very real public health crisis. It drives deep-seated psychological shame and forces massive numbers of adolescent girls to stay home, severely limiting their educational opportunities. Driving these physical restrictions is a singular, widespread assumption. The idea that the female body is harboring something toxic, hazardous, or biologically contaminated. But if menstrual fluid isn't dirty blood or a hazard to anyone else, what exactly is it? What physical process is actually occurring inside the body? Separating these cultural restrictions from biological facts begins with a clear look at what is actually happening inside. Menstrual fluid is a normal physiological mixture of blood, shed endometrial tissue from the uterine lining, cervical mucus, and vaginal secretions. It contains absolutely zero toxins. A healthy vagina maintains a strictly acidic pH between 3.8 and 4.5, patrolled by lactobacillus bacteria. Menstrual blood has a neutral pH, temporarily diluting that acidity. This brief shift makes yeast infections and bacterial vaginosis slightly more likely. This temporary shift requires specific hygiene practices. The internal system is entirely self-cleaning. Internal douches or special soaps only disrupt that fragile microbiome. Medical guidelines recommend washing only the external vulva with clean water. Hygiene practices during this time should focus on supporting this self-regulating ecosystem rather than disrupting it. This vulnerability dictates how we use menstrual products. Disposable pads and tampons are safe when changed every 4 to 8 hours. Leaving them in longer creates a warm, moist environment that encourages bacterial and fungal overgrowth. While concerns occasionally circulate about trace dioxins from bleaching or the severe bacterial infection known as toxic shock syndrome, these events are exceedingly rare. The primary, everyday risk is simply poor moisture control, leading to localized irritation. For women using reusable cloth pads, the same principle applies. They are safe, provided they are washed thoroughly and dried completely in direct sunlight. Ultraviolet radiation acts as a natural disinfectant, penetrating the fabric to eradicate fungal spores that thrive in damp cloth. Clinical data shows that menstrual cups have the fewest adverse health effects of any product on the market, provided they undergo standard thermal sterilization, which just means boiling them in water for 5 to 10 minutes between cycles. Regardless of which product a woman chooses, her health safety relies on simple moisture control and evidence-based sterilization protocols. These same biological principles help clarify the myths surrounding physical activity, specifically the idea that women must avoid bathing, swimming, or exercising during their cycle. To understand why movement is beneficial, look at the cause of menstrual cramps. The pain is driven by inflammatory compounds called prostaglandins, which trigger the uterine muscles to contract. Regular physical exercise actively combats this pain. When you move, your body releases endorphins. These hormones naturally reduce inflammation and bind to cellular receptors to block the pain signals mediated by prostaglandins. It is time we replace the concept of impurity with the scientific reality of physiology. When we replace restrictive taboos with accurate health education, an approach championed by the team at Akkineni Hospitals, we normalize the conversation. We keep adolescent girls in school, and we empower women to take confident, safe ownership of their bodies.